And
Hmm.
so as we talk about the benefits and catharsis of speaking to someone, how do you maybe identify when someone might be not just having a tough time, but they're really moving in a direction that anyone that loves someone else would want to stop? How do you look for those things? And maybe you can go into a little bit more about what you've seen in your work.
Hmm. Hmm. So, what with my work, what is sort of something we like stumbled on, or I sort of stumbled on somewhat unintentionally, is that in the world of suicide, so much of the interest in the sort of the mental health space is identification and like prediction. So trying to say, what are the odds that this person is going to attempt suicide in a serious way or die by suicide? And one of the things in my work that, well, is mostly based on other folks' work, but the realization that like we can't really predict these things in a useful way at all.
Hmm.
So what I oftentimes give presentations on and talk to practitioners about is let's stop focusing on trying to predict suicide because we can't do it in a clinically useful way. So there's a study done. So a lot of the stuff that looks at this is sort of these huge samples of patient populations and this sort of thing. And there's a study done where they looked at if we have patients and we categorize them as low risk versus high risk. And this is often what we do is we collect a bunch of information on what we call risk factors for suicide. And we categorize people as either having a low risk of suicide, a medium risk, or a high risk. And the idea is, okay, so if this person's low risk, then I don't need to do any substantial intervention for preventing them from dying by suicide. But if they're high risk, now I need to really consider what I should do to perhaps keep them safe. And what they found was that for the high risk folks, it was 1 in 45,000 of, no, let me do it again. For the low risk folks, it was 1 in 45,000 who died by suicide in the next 24 hours. For the high risk folks, it was about 1 in 20,000 who died by suicide in the next 24 hours. So is 1 in 20,000 like, is that predictively better than 1 in 45,000? Yeah, absolutely. But it's clinically useless
All right.
because 1 in 20,000, like, what are you going to do with that? Like, what should I do with 1 in 20,000? Like, that's the odds are ridiculously low, which is a good thing. So one of the things that I really push is for practitioners and in general, like, stop trying to predict. Like, there is so much uncertainty in this. Like, don't focus on that stuff. Now, of course, that isn't to say that if somebody says, I have a firearm in my car and I'm going to go use it, or I have, I have a bottle of pills I'm going to go take them. That's not to say to ignore that and not do anything. That's not what I'm talking about. What I'm talking about is sort of these, as mental health practitioners, we're trained on these suicide risk assessment forms, where basically we ask clients a handful of questions. Based on their responses to those questions, we create some, you get a 3 for this and a 5 for that and a 7 for that and a 2 for that. And if your score is 37 or higher, then you're in the high risk category. So that then we make decisions based on that, things like hospitalization. And what I'm saying is that most of that is just nonsense, that it is clinically
Hmm.
not helpful. And so let's not focus on these tools for risk prediction, which is clinically useless. Instead, let's focus on the person and their pain and their suffering and how we can be there for them in this moment. So that's what we want to do is we want to, or what I am constantly arguing for is moving away from this prediction thing and moving towards actually being a human being and a good therapist and being there for your client. So I think similarly for folks who aren't mental health practitioners, who aren't trained, that of course, if there's something that's really dramatic that you might, want to do something to help keep that person safe, but the primary, like, just be there for the person. Like, I always think, like, that's the main thing. Be there for the person.
Yeah. Is that the concept of the empathetic witness?
I don't know. I'm not familiar with that.
Yeah, I've heard it in reference to, I think this, that like someone just wants to have an empathetic witness that
Hmm.
sees them, right? And so they can emote, they can explain, and they don't need this. I mean, the whole. I mean, it's a bit of a trope for with like the woman telling her husband like, stop trying to solve this thing. Let just let me
Hmm.
complain, right? So it's a bit that scenario where someone who wouldn't have they have a real problem. Sometimes people want solutions, but mostly they just want someone to, like you said, human connection, to know that they're on this journey with somebody.
Hmm. Hmm. Yeah, I think that there's all sorts of benefits that can come from just being a good listener, a good person. One of them is that, right? So there is that sense of connection, but also oftentimes with that connection, that the person will just gain clarity, right? Because if they have the opportunity to talk, um, yeah, and oftentimes folks who are suicidal, m- more often than not, they don't want to die. They want the pain to stop.
Right.
So oftentimes folks who are suicidal, they see death as a way to make the pain stop. And that's not illogical, right? That's reasonable, right? I mean, in a way, right? Because it's like, oh yeah, that the pain will
Yeah, I've read
stop.
a lot of research on this where they say like they feel like they're a burden to the people in their
Mhm.
in their lives, and there's no worth, they have no utility, and that yeah, and the solution to that, yeah, I guess that feeling, that pain is an exit, which is devastating. I mean, I mean, you've probably been around this world in a much more profound way than I have been looking into it, but like, I mean, it really affected me, like reading some quotes from some of the people that even
Oh,
had suicidal ideation and things like that, and it's devastating. Some of these that if only the people closest to them knew that they were having these sorts of real actionable thoughts of ending their own life,